All right. Thank you, everybody, for joining us today. We're going to give folks another minute or two to join, and we'll plan on getting started here in the next 2 minutes or so. All right. Looks like we've still got folks filing in on the webinar here, but probably a good time to go ahead and get started with things. So thanks, everybody, for joining us today for this webinar hosted by talking about a topic that has uh, really over the last year and even prior to that, the last couple of years, and that is sort of the state of mental and behavioral health in the workplace, and specifically the state of mental and behavioral health and sort of related to the added stress that has been brought on upon by the pandemic that we're all still currently living through. Hard to believe here we are a year later. But that is our reality. And we today are super excited to have Joanne Jodry, who is a professor at Monmouth University, a public speaker and an author on the topic. She specializes in mental health counseling and gives lectures and TED Talks on this topic very often. So super excited to tap into Joanne's knowledge and expertise on this and her thoughts on the pandemic and general state of, as well as how that impacts employees and employers. I'm Rob Lehane, the CEO of TouchCare. TouchCare is a healthcare concierge service. We work with employers, big and small, all over the country to deliver a better member experience to their employees. So helping folks navigate all of the complexity of the healthcare system with the goal of, like I said, making sure that they have a great experience with healthcare, they get the best quality care that they can find, and they do it for the best possible price. So guiding folks to high quality, low cost providers, helping them solve complex billing and claims issues, helping them find providers in places where they might be difficult to locate, helping them select and enroll in their benefits, et cetera. So really helping folks through the entire life cycle of their benefits experience and journey. At TouchCare, about 8% of our total cases historically are actually related to mental and behavioral health, folks looking for service providers in areas where we work. And so this is a topic that is intimately familiar to us as well. And as a result of that, combined with the pandemic, we have also released a number of resources and services that we'll talk about at the end of the presentation here. But to kick things off, I'm gonna give the controls over to Joanne and let her take us through the presentation here. So Joanne, it's all yours. Thanks.
Thank you. Hi, everyone. I'm so excited that you decided to join today to talk about mental health. It's a very topic I'm very passionate about, and especially right now with the pandemic stress that we're all under. You can see here from these statistics that these are reported statistics, and there's a whole bunch of statistics that are unreported. So many people suffering from depression, anxiety, trauma, stress, acute stress, alcohol and drug abuse. 13% of people have reported that they have an increase of alcohol and drug abuse. People aren't even noticing that they're using more substances right now because lifestyles have changed so much. But more than that, are increasing their drug use. And of course, one that we're the most concerned about is the suicide rates are rising. And this is something that we all need to help each other and pay attention to so that we can help the folks in our workplace and the folks we care about. The other thing I want to mention just statistically is something that also goes up vastly is domestic violence and child abuse. Those numbers shoot up as well, and they go more unreported than normally. So that's another thing that we have to keep in mind. So let's talk about the pandemic process and what's happening to people as these things are occurring. So when we have something that happened like this pandemic, we have no context or reference for this. We don't know what to do. We never had a pandemic in our lifetime. We may have a grandparent who told us about 1917, but it is not at all the same. So there is no context for how to handle this and what to do. We first get the news and it's shocking. It's kind of unbelievable. Like, what do you mean a pandemic? And we're pretty tech savvy and we're pretty medical. We're America, right? We can handle medical conditions. We're the best. And what happened to people were some people panicked and fear set in, and other people went into denial and they mocked it. They thought it was the same as the flu. Now, both of those reactions are normal psychological reactions to handle news that's shocking. Then what happens is you turn into your thought process of disbelief or misinformation in order to handle it, in order to put it in your brain and allow it to exist. Then we move into lockdowns. Well, that feels like a whole lot of control I don't have over my own life. It feels like the government is scaring me in a lockdown, telling me to stay home. And people reacted differently to this. And we had this sense of isolation. And I'm going to skip a bit, but this was the toilet paper saga of 2020, right? I need to make sure my family is safe. You know, the toilet paper thing became a joke, but I need my family to be safe. I need all my family's needs met. I need food. You walk into a store and the shelves are empty. That's a scary, scary feeling. And so people started to pay attention to the needs, the basic needs that they had, which they weren't fearful of prior to this. There's a child care crisis that then happened. Schools shut down, the legal system shut down, medical systems had shut down, non-emergency medical systems. You couldn't get those non-emergency surgeries anymore. Your whole world got shifted. And then there was also, when the schools shut down, you become the tutor to your child, or you get a tutor for your child. And many people are crying about algebra now. We may have cried when we took it the first time, but now we're crying about our kids' algebra too. And you're not a teacher unless you are, and you're not prepared to do those kinds of things. And how do I manage my childcare and go to work? Or maybe I'm home working virtually and I have to run because my child's teacher is calling, but I'm on a Zoom call myself. So then we have this misinformation that also was out there, and you decide who you're going to believe. The uncertainty is worse than certainty. So people choose to believe someone. And they pick a side to believe. They pick a place to land and they double down on it. One of the things I think that's been most hurtful to us are these false deadlines. When the pandemic first, Rob just said, can you believe it's a year? No, we cannot believe it's a year, because we were told it was going to go away quickly. Then we were told 3 months. I think Easter was a deadline. Summer was a deadline. Christmas was a deadline. And we keep having these false deadlines. Well, what does that do to us psychologically? We think, okay, I can maintain this from here to here, and now it's not over. A prolonged trauma like that. So we keep having these shortened versions of when normal is going to return. I heard recently on the news, one person said this summer we're going to go back to normal, and another person said the end of the year we're going to go back to normal. I'm not sure what normal is and what we're going back to, because psychologically we've been shifted and we've been changed. So these false deadlines make us shift to I can make it to this date, and now the date happens and nothing happens. And here's the biggest problem. Everything is uncertain. Is my kid's school going to stay open? Is my job going to be there? Is my job essential? Well, there's a blow to us, right? All of a sudden, you're not an essential job. That hurts a little bit, hurts the pocketbook, but it also hurts the psyche, because I thought I was essential before that. So many things are uncertain. There's very little that is certain, very little. Can I travel again? Can I book a flight? What can I do? Should I, Christmas was different this year for people. Can I plan a party? Can I not plan a party? I happen to be lucky enough to be vaccinated, but nothing really changed when I got vaccinated. So I'm not sure even if that's going to create a lack of uncertainty. Okay, Ralph. So other factors that are going along with this pandemic happen to be happening, I don't know, chicken or egg. I don't know if it's causation or not, but they're happening at the same time. We have a hard political division. Part of uncertainty makes us want to know, makes us double down on knowing. So we have this large political division. We have family division based in the political division. We also have racial divisions and what, where I'm taking stands at. And the environment certainly did not stop for the pandemic. So there's also an economic crisis for so many people. And even if it's not your employee and your employee is still getting the same salary, someone in their family might not be. And there's the constant strain of, is my company safe and going to stay financially secure? And then there's new strains of it popping up, of this pandemic, of this virus popping up. And so does that mean this is going to go on forever when I see things like that? And then there's all this misinformation out there. And I don't know what's right. You don't know what's right. I'm not making a political statement, but do I believe the leaders? Do I believe the science? Do I believe my mother? Because my mother says I should always believe my mother. But who do I believe? And I want to believe somebody. There's a natural inclination to want to believe somebody. So I do pick something to believe in rather than sit in this uncertainty that is so frightening to sit in. So the employee experience for you guys to consider is this lack of control over the environment, and this uncertainty causes a crisis for many people. A crisis, a definition of a crisis, is when you feel you do not have the coping skills to deal with the situation at hand. Well, that's kind of all of us, because nobody lived through a pandemic before. We're a year in, and those of us who have lived through it have a little bit of coping skills because we've dealt with it. But some of us are coping better than others. And that's where the mental health comes in. How are we coping with all of the issues that come along with this crisis? Some of us are most of us moved into this protective mode. Like our houses became sanctuaries. The price of houses went up. I don't think that's a coincidence. Everybody wanted to own certainty and be somewhere, have a house to be protected in. We have fears over the virtual world. I don't know about you all, but if the internet dies, it's over for me. My entire life is virtual now. And the dependency on the virtual world, but also the skill of all these virtual parts. Do I have the skill to do this? And I'm not trying to be ageist here, and I'm not being, but it tends that older people who aren't as internet savvy, as virtual savvy, as competent in these, there tends to be more fear, and we have to address that, because it feels like sometimes I'm obsolete because I'm not using the internet correctly. Hypervigilant over being diagnosed with COVID. COVID does have a higher mortality rate than other flus, but it also has a high survival rate. And I'm more afraid and hypervigilant. You go outside and you see people without a mask, and you're looking at them with, an evil eye, because you're afraid. You're afraid of getting it, perhaps. And you're afraid for your family to get it, especially older people who have comorbid issues with it. These false deadlines create a sense of hopelessness, because if I put my hope in, okay, on that day, it's all going to be okay and things can go back to normal, and it doesn't happen, it creates a learned hopelessness. Like, now I don't believe it's ever going to end. Now I don't believe it's ever going to be okay again and normal. And there's this malaise that comes over us of hopelessness. And there's a mistrust of information. And as I said earlier, that creates us to take stronger stances on information, even if they're not backed up by evidence. But I'm going to take a stance because I need to know. Knowing makes me feel safe. Unknowing makes me feel unsafe. And I feel very unsafe in this entire culture and environment right now, with a pandemic attacking us and the climate attacking us. And maybe my neighbors with different signs out in front of their houses attacking us. And so what I need to do now is know, even if I don't know. And that's part of what's happening. So some things to consider that your employees have lost, and think about what that might be doing to them. And by the way, obviously this isn't just the employees, it's also you. But some people have lost a commute. Now, I would have given anything to lose a commute before the pandemic. But what does a commute do to you? It allows you to transition between work and home. It gives you that time to transition your thoughts, to transition your mind, and to transition your identity. As a therapist, and I'm a professor, when I go to work, people think I know something and they treat me that way. When I go home, they think I know nothing. I don't know which one's right. They might both be right, but there's a different identity in both of those places. I'm also able to compartmentalize. When I'm at work, I do work. When I'm home, I do home. For some people who are working virtually, that's no longer true. They do work, they do the dishes. They do work, they go, help a kid with algebra. The privacy for people working at home, I have seen most people's houses at this point. That's something that we kept different. Unless we were personal friends with someone at work, they never saw my house. And, for some people, I might be embarrassed about my house. I might have a small house, or I might have 4 kids in 2 bedrooms in my house, and I might have a lack of privacy, but I also have you zooming into my house potentially. Obviously, the socialization is the biggest part of it. And I've had people say, well, I'm an introvert anyway. Yes, even if you're an introvert, you get to make eye contact with people and create relationships even as an introvert. One of the biggest things we've lost is a sense of joy. We had joyful activities of milestones, graduations, birthdays, holidays, and most of them have been dampened by fear. We also have inner joy, and inner joy cannot be fully realized when we have a chronic stress and hypervigilance happening within us. We can have inner joy, we can have moments of it, but we can't get to inner joy when we have this chronic stress on us. The sense of safety for myself and for others, job security, even if it's not your job that they feel insecure, it could be their spouse's job. The trust of other people to tell me the truth, the trust of other people that I believe and respect them. There's a lot of disrespect going on in our country, and it's intertwined with pandemic and politics and all of those other things that you can't really not put together because they've put themselves together. And one of the big things to consider is where the person places the meaning of their job. If you're a non-essential worker, what's essential? Food, water, shelter, and medical is essential. Everyone else is kind of not that important. I don't know, that does something to you financially, maybe fearfully, but it also does something to you psychically. It makes you question, perhaps, am I doing something that's important? Is what I do an important contribution to the community, to the world? There could be some kind of existential thoughts going on in there. And then there's loss. You could lose someone to death. I don't know about you. I know many people who have died from COVID and other reasons in the last year. Because I'm a therapist, probably I know a lot of people who have died, but a lot of people know a lot of people who have died. And then we also have losses of, I'm no longer talking to my cousin because he or she voted for X, or he or she doesn't love America, or whatever the reason is. I am no longer going to communicate within the family, and that's a loss. There's physical health concerns. We do not know the long-term effects of COVID, but I do want to make sure that you're all alerted to the fact that some people who do have COVID also have experienced psychosis during and after having COVID. I don't think we have a handle on why that is yet, but know that it is. And, you know, keeping yourself aware of that some people are having psychosis, delusions, and hallucinations comorbid with COVID. The household income could be a loss if people worked a second job, or if, you know, I know in higher education there's universities doing pay cuts across the boards because of the economic situation. The sense of control, the sense of knowing, and being able to have clear expectations is lost. And that makes us afraid. And one of the things that seems like it wasn't a big deal until you miss it is the eye contact around a conference table. The how was your day? Hey, do I get to see pictures of that baby? That stuff matters. And it didn't seem like it mattered that much until we don't have it. You know, we have a new word in our dictionary. We're zoomed out, right? We're all sick of Zoom. We're all sick of looking at these screens. And so we don't make time necessarily for these niceties and these little conversations that we used to have around the water cooler or in a meeting. The personal effect, it's gone, and it's a loss. Okay. So what are some of the things that could be happening to some of your employees? There's this brain fog. Now, we put brain fog on as if it was some kind of pathology. It is not a pathology. Many people have it right now. And what's causing it is not being able to focus in one place and a chronic stress. We have a chronic stress collectively, our entire culture, and we can't always focus on what's happening at hand. I might be at work and the doorbell rings. I might be at work and my kid starts to cry, and I'm home. Or I might be at work and I'm not sure about whether or not my kid's being cared for with different childcare needs. We have less joy, as I said. We don't have the boundaries between work and home that we used to have. Time is fluid. Priorities are fluid. I get the meeting done I have to do, but then I go do a load of laundry sometimes if I'm working from home. That gives me brain fog because I'm not focusing. I'm not able to concentrate my mind all in one place. There's a self-judgment that's happening. I don't know about you guys, but I was going to write a book last March by June because I had 3 months off from work. So I was going to write a book. That didn't happen because what happened was this brain fog. And also what happened was I had all this like, wow, good, this is awesome. I get some time off from doing what I do, and I'm going to be really productive. I don't know if anyone was actually really productive when they thought that was the way it was going to be, because this was just a break from work. As Rob said, it is now a year later. And so we are judging ourselves. We have potentially more time at home, but we potentially also feel less productive. Now, we may not be less productive, but we might feel less productive because we're not focused. And that self-judgment can lead to anxiety, can lead to bad self-esteem, can lead to a lack of identity. It can lead to some bad things. And we also might have fear of losing our employment or the company's financial health. We may have a mistrust of our leaders in the company because we have a mistrust of our larger leaders in the country. The meaning that your job has is important right now. It's important for people to explicitly say what the meaning is, why their job is important. And that's something that you all can do with your folks. Emotion, anger is what I mean by that, and impulsivity are not always in control now. Because we are more tense, because we're living in a chronic stress state, we sometimes lose temper easier. We sometimes do things more impulsively and are a little snappier. recognizing that that's a probability of what's going to happen to some people. And the isolation and loneliness is real. It is very hard. So many people are lonely. And even if you work and you go to work, I'm in my office right now at a university, and I'm the only one in the building. It's creepy. It's creepy here when you're like that. So even though I'm at work, I am still isolated. And I think that happens when you see people missing from desks. It's a little creepy. Okay. So the psychological barriers for people saying, yes, I would like to go see a counselor, I would like to get help. There is a stigma that is associated with counseling and mental health that I hope in my lifetime we can get rid of, but I don't know if it's ever going to happen. People are doing unhealthy coping skills, and you want to be aware of this. What are they doing? Raging, anger, alcohol, and drugs. They go home and have 3 glasses of wine to get to sleep, to calm down, or they're home. And so they're not driving, so they can have those 3 glasses of wine. And they don't even know it's 3. It used to be 2, now it's 3. But they don't even recognize that necessarily. But it's helping them calm down, it's helping them relax, get rid of that chronic stress. People say they have no time to go to therapy. We're going to talk about telehealth in a minute, because that does save a little time. And that there's too much money. I often joke with my students and I say, I can't afford to come to me. It's a kind of a joke, but it's not really a joke. I think there's a truth to that, because therapy can be very expensive. They can't find services. We are so busy right now. Mental health professionals are so busy right now that most of the folks I know are full. They think other people have it worse than they do, and that if they're not on fire, they don't need to go to therapy. Not recognizing that therapy can keep you well, not recognizing that it's a choice, that it doesn't need to be a need, it can be a want. And they also need to know through their workplace that it really is confidential therapy. That is a fear that people have, that their workplace is going to find out and that they would somehow be stigmatized, especially like police officers or military folks and things like that. They're afraid of the stigmatism. Okay. So some potential long-term effects. One of the things that needs to, we talked about certainty and uncertainty. One of the things that needs to happen is people need to see what the new normal is going to be. People are waiting for things to go back exactly the same. I don't know if that's going to happen. Now that we know pandemics exist, and now that we know about viruses, we have a new normal in our psyche. When 9/11 happened, we all thought that a plane accidentally crashed into a building because we didn't have a reference for being attacked. Now we know we can be attacked, and our psyche is never the same. Well, now we know we can have pandemics. And now we know that my neighbor, who I never talked to about this before, votes for someone different than I vote for. So how do we go back to normal? I don't know if we can. So what is the new normal look like in your company? Also, these virtual skills, I've heard people say, especially in Manhattan, why am I paying these high rents when my employees are doing just fine from home? Are they going to, how are these virtual skills that a lot of people have adapted to going to fit into the new normal? But your customers, your employees need to know what it might look like as soon as you know. The other thing is, we know in mental health that when we have a crisis, any crisis, addiction rises greatly. And this is going to happen in an even larger scale because of the prolonged amount of time with this crisis. Addiction is going to increase like leaps and bounds. And having those services available for your folks is going to be so important. There could potentially be PTSD to this event. On a minimum, there's no such thing as TS, but there is at least traumatic stress happening for so many people. It might not lead to a disorder, but people are experiencing traumatic stress, anxiety and anger, other emotions, physical health concerns. The teachers right now are afraid to go back in the classrooms because they perceive that they're not safe. Schools were germ little havens before this, and now teachers are afraid to go back in, that they don't feel that it's safe to go back in. I don't have a political stance on that, but I know if the fear is there, they're not going to perform the way that they should. And so whether it's real or not, I don't know, but I know they perceive it that way, so therefore it needs to be addressed. And so does your workplace. And then, does your workplace have less existential meaning to your employee now? And if it does, then you have to build the existential meaning back in so that the employee can feel good about being a contributing member of our community. Okay. So how can we best help? Recognize the possible changes and losses collectively to the country, your community, and to the individual, and create a place that is really safe, really confidential for the employees to check in. Have human contact, but also to say, yeah, I'm having a bad whatever. Be explicit about the meaning of the job and how it helps society. Talk about the brain fog. Don't let them compare themselves to their old selves. The pre-pandemic brain is not the post-pandemic brain. And if we compare our workload, we might be doing the same, but we're not feeling the same about it. We might not be praising ourselves the way we would because it feels piecemealed. Help set boundaries and when work stops. Usually you get in a car and you go home. We don't always have that now. So there needs to be a time when work stops. There needs to be a time when it starts to. Adapt to the new normal rather than waiting for this false return to normal. It's not coming. There's a new normal. I don't know what the new normal in your company is, but it's a new normal. And allow it to be normal now. Let this be normal. What if, and I don't think this will happen, I hope not, but what if everything stays this way? Then we have to adapt to it being this way, and we have to make this normal. The sooner we can give a sense of control that this is okay the way it is, we're going to do things and adapt ourselves to make ourselves joyful again, that's going to be better for the employee. Create a water cooler experience, meaning maybe sometimes just to catch up on each other's life. You know, that conference room that you sat around and somebody said something and you made eye contact with somebody, that's kind of gone because on Zoom, everybody sees you, so you can't make those faces at people anymore. That's important stuff that you used to have as a stress relief. Also, it would be nice and hopeful for if you mandated it for people, if you did regular relaxation things. And I just put some things up here. You can be creative in what they might be, but a morning or afternoon breathing session. It sounds trite, but it really does help to deep breathe. You know, maybe a meditation class, not like a spiritual or religious meditation, just a relax your brain, give your brain a break meditation, some yoga stretches that you do in the morning or you do, before you end the day or things like that, any of those type of things. And I'm sure you have more than I do about ways to relax, but offering that to your employees would be a great way to help. Okay. So one of the things that we need to do is normalize and destigmatize by sharing stories, creating campaigns. We need to normalize mental health. And it should be mental health wellness. It shouldn't be mental health illness. It should be mental health wellness. And anybody right now can benefit from mental health. I recognize I'm a therapist and that's my hammer. I'm not suggesting everyone is a nail. I am suggesting that we need to be able to say, if you have any of those major stressors that I just went over and you have a couple of them happening, like you've lost somebody, now's the time for some mental health wellness. And let someone else hold some of this with you. Let a counselor hold some of this with you. You can do trainings to help people decide if they want to go to counseling. People shouldn't need to go to counseling. They should want to go to counseling. Most people think they go to counseling when it's a last resort, when all else fails and I'm hanging on by a thread, I go to counseling. That's when we go to inpatient. So what we need to do is do wellness counseling. You want to warn employees about what bad coping skills are. Alcohol and drugs, bad coping skills. Popping more Xanax to get through the day, bad coping skill. Anger, letting loose your anger on your family or even at work, bad coping skill. EAP programs are always an awesome addition to any company. Encourage taking advantage of telehealth, it does save on time and money. And so it is a very acceptable. I'm personally doing telehealth now, and it's a very acceptable way of helping. I don't see very much difference between doing in-person counseling and telehealth in terms of getting clients through this time. Remove barriers for people so that they want to go to therapy, and the time and money are two that are easier to take away. Okay.
Awesome. Well, Joanne, thank you for all of that background information. And I think, one thing that I would just like to sort of add and supplement to all of that is that while this is new in the sense that it's the first time that we're all facing a pandemic or a life event on this scale, or a life altering, I guess, event on this scale, and for this duration, the crisis that this country, and I'll call it a crisis, has been facing, um, with relation to mental health, and specifically employers who are trying to keep their employees healthy and productive and in the workplace, et cetera, is not new, right? And we've seen here at TouchCare, we did a dive into our own data over the last 10 to 12 months, just exploring what the difference was in the types of inquiries that we were receiving, um, from our folks. And we saw during the pandemic a 100% increase in behavioral health requests versus before the pandemic. Um, and we saw, that the other number there, 153% jump in the number of people requesting assistance with using or understanding their healthcare benefits, and specifically looking for help on how those benefits cover mental health needs. And I think one of the things that the pandemic has done, right, is really just emphasize or highlight the need to address this problem, for employees. And I shouldn't call it a problem. The problem is about a quarter of Americans have an underlying mental health condition, according to numerous studies, and most folks aren't addressing those issues for whatever reason. You went through, maybe it costs too much, maybe it's tough to find a provider, and maybe there's a stigma that they're having trouble getting over, et cetera. You know, is just the lack of providers, um, zip codes. So, you know, we've pretty heavily, and I think the world is coming around. Is a component for managing psychological issues for members, and this is during the pandemic and before the pandemic. And one of the biggest challenges that we face here at TouchCare, we're in New York and New Jersey, where sometimes it's tough to throw a rock and not hit a mental health provider, but in certain parts of the country, it's nearly impossible to find somebody, whether it's somebody within a certain zip code or somebody within 100 miles of that zip code. And there's folks who need help in those areas. So we actually, at the beginning of this year, launched our own internal therapy solution that is powered as a telemedicine solution. And really what that was done for was to solve the problem of access, and making it easier for folks to get appointments with licensed specialists or therapists, in the area that they needed help, whether that be psychology, psychiatry, child psychology, child psychiatry, et cetera. And just breaking down the barrier of actually giving folks access. And I think that's where the real power in virtual therapy and telemedicine has been realized for us, and it's been a really great offering for us to have for our clients, specifically during this pandemic when nobody was able to go to the doctor for a long time anyways. And then you sort of combine that with this increased awareness and an increased need for mental health services. And really, I believe that employers need to start thinking about how they offer the right tools to their employees to meet their needs, right? And those needs change and evolve over time, and technology changes and evolves over time. And so, the challenging thing for employers, for HR folks, for insurance brokers is to be able to sort of evolve along with those things and make sure that your health plan or your employee benefits program actually meets the needs of your employees. And right now, those needs are now more than ever services that provide them an outlet for mental health services, to get them access, to get them good quality care, and virtual therapy is really becoming the sort of the solution for being able to provide that in a timely manner, in a way that's effective, and that gets folks the help that they need. And so with that, I think we are coming to the end of the presentation. We thank everybody for joining us today. I think we're going to open it up for a little Q&A here, and there have been some questions already coming in, I believe. So I want to make sure I can try to access those here. But if not, you can type questions into the question box. All right, cool. So will employees be able to reach out to therapists/psychiatrists anonymously, or is that done by HR? Okay, so I guess this is a question probably specific to the TouchCare virtual care, virtual mind care offering. And the answer is it's anonymous. So folks are able to reach out anonymously to therapists and psychiatrists, and get services that they need. Another one, can employees change their therapist at any time? Yes, the answer is yes. You're able to select your therapist. The intake process kind of takes you through a questionnaire and and asks about your needs and what you're looking for, and then ultimately you're given a handful of providers to choose from. And so you can do that, and you can continue on with the same provider for indefinitely, or you can switch at any time. Sorry, just reading through these here. What can the virtual psychiatrists diagnose? Can they prescribe medicines? Yes, they can. And so it's full-blown psychiatry. They are able to diagnose. They are able to prescribe medicines in a virtual format, which is a pretty powerful offering. And typically, as you can imagine, those are some of your more I guess in-depth or urgent matters that are being addressed and prescribed for. Couple more coming in here. Is Mind Care technically an EAP or more robust than an EAP? What is the cost component to add the service? Yeah, so our Mind Care services to be sort of, I guess, more robust than what you would get from a typical EAP. It is full-blown therapy solution meant to take an employee through of having a therapist virtually. And so, most of the time with an EAP, you get a couple free visits with an LCSW, and then you can potentially continue on. But the Mind Care solution is really designed to, from the outset, connect you with the right provider based on your needs, whether that psychologist, CSW, like I mentioned, a psychiatrist specializing in the specific area that you need help, and function much more like a traditional psychiatry or psychology and patient relationship, with regular visits scheduled for 50-minute blocks, with a copay, etc. And I think that is all that I see for questions here. We'll give it another second. One quick reminder for everyone, is being we will set for the slide presentation afterwards if folks need anything. And in order to get in touch with TouchCare, very, very easy. If you don't already have a contact at TouchCare, you can reach out to sales@touchcare.com. Looks like no others are coming in. We will say thank you to Joanne. Really appreciate your time and your thoughts and expertise on this issue. Obviously, super top of mind for us and many of our clients and partners right now. So much for joining us, and to the folks on the line, really appreciate your time. I hope everybody has a great rest of the day. Thanks.